So this is about healthcare, as I promised. Um, and I'm just going to jump right into it. The United States spends more on healthcare than any country in the world, and yet millions of Americans still can't afford to see a doctor. So what exactly are we paying for? For example, imagine you wake up with severe chest pain. You go to the hospital, you get tests, maybe even stay overnight. A week later, you get a bill for thousands of dollars, even though you have health insurance. Let's try to understand why this happens. To do that, we need to take a look at the U.S. healthcare system, how it actually works. Because here's the problem, we don't actually have one system. We have several. In most countries, there's one system that covers everyone. In the United States, there are at least 6 different systems, all trying to do the same thing in different ways. Just as an example, there's employer sponsored healthcare insurance, private plans, the ACA marketplaces, Medicare, Medicaid, and the VA healthcare system. Each of these systems has different rules, different coverages, and different costs. And as a result, it isn't really a system at all. It's a patchwork. Now, that complexity doesn't just make things confusing, it makes them expensive. The U.S. spends over $4 trillion a year on healthcare, more than any country in the world. But we're not necessarily paying for better healthcare. A lot of that money goes somewhere else. Administrative costs, because we have so many different systems. Providers have to deal with multiple insurance companies, billing rules, and approval processes. That means more staff, more paperwork, more time spent navigating the system instead of treating patients. In other words, we're not just paying for the health care. We're paying for the complexity of the American system of healthcare. And then you've got the insurance companies. They act as intermediaries between patients and providers, negotiating prices, approving treatments, and managing risk. But they also add another layer of cost. And drug prices. Drug prices are another major factor in the United States. There's no single system negotiating price across the entire population. So pharmaceutical companies can charge significantly more than they do in other countries. And then there's hospital pricing. There's no standard pricing for most procedures. So two people can receive the same exact treatment at the same exact hospital and be charged completely different amounts. When you add all this together, the complexity, the layers, the lack of standardization, the cost starts to make a lot more sense. But high cost isn't the only issue. There's something else that surprises a lot of people, and that is having insurance doesn't always mean you'll get the care you need. Most treatments in the U.S. require some form of approval from your insurance provider. often called pre-authorization. And if a treatment is denied, whether it is procedural, medication, or a specialist, you may not get that care at all. Or you may have to pay for it entirely out of your own pocket. These decisions are often based on whether something is considered medically necessary. But that determination isn't always made by your doctor. In many cases, it's made by the insurance company. So, in practice, your access to care can depend not just on your doctor, but on what your insurance company is willing to approve. Even beyond the denials, there are other limitations, like the restricted provider networks, long approval times, the high out of pocket costs and copays. So even if you're insured, access to care isn't always guaranteed. And when you step back and compare this to other countries, the difference becomes even more clear. Other developed nations spend significantly less on healthcare per person while often achieving better outcomes. They have a simpler system, more consistent pricing, and universal access to care. Meanwhile, the United States has higher costs, higher rates of medical debt, and millions of people who are either uninsured or underinsured. So when you look at the full picture, a system made up of multiple overlapping programs, high administrative complexity, rising costs, and no guarantee of access. The system is this complex, this expensive, and still doesn't guarantee care. Then the real question isn't whether it needs to change. The question is, what do we replace it with? That's what we're going to look at next. We're going to discuss a policy in depth that could entirely change the U.S. healthcare system. And again, as with all of my policies that I talk about, there is no 100% guarantee that this is the right policy. Um, and that's why I discussed it. I want to hear your opinion. Remember, it's more important to vote policy than politics. So next week, we'll start healthcare, the first video. This has been Not in Kansas Anymore. Check out my other videos. Um, and I appreciate all my subscribers and my return viewers. And I thank you for watching. If you find any value in my videos, please like, share, and subscribe. Hit the notification bell if you want the weekly updates. Um, and we will see you in 1 week.